Hi guys, welcome to my Ed Talk. So I'm going to be talking to you guys about the difference between side effects, adverse effect, and toxic effect. So normally when we give a medication to a patient, we're trying to create this therapeutic effect in our patient. So to give you an example, we have a patient who has an infection, and we're going to give that patient antibiotics in order to create this therapeutic response of destroying the bacteria or stopping it from reproducing. However, whenever we give medications, they can cause effects, and I'm here to talk about the difference between those effects. So, to start off with, side effects. So, that's a benign response other than the therapeutic effect. So, to use the same example, and I'll be using probably the same example throughout these scenarios in order to compare. So, to use the same example of the antibiotic, you give the patient the antibiotic and they end up developing diarrhea, they're nauseous. Well, we know that this is a known side effect that can happen with patients taking antibiotics. It's mild, it can be self resolving at times. It does not hinder the response that we're looking for in our patients. Even though it's unwanted, it's more predictable. And adverse, on the other hand, so this is a serious response other than the therapeutic effect. So for this one, we give our patient vancomycin and they end up developing Bredman syndrome. So we know that this is an adverse effect because it's severe and life threatening. It can actually hinder the response that we're looking for in our patient because it can lead to more complications. So to compare these two for side effects, even though it's unwanted, they can usually continue taking this medication because the benefits outweigh the side effects. On the other hand, if they're having an adverse effect, this is a serious and it can be life threatening. So we're actually going to have to do some interventions in order to try to help what's happening to this patient. On the other hand, toxic effect. So this is an overdose or prolonged administration. So to give you an example of overdose, so we have a patient who came in with Tylenol overdose. Well, we know that Tylenol overdose in high doses, it can have the toxic effect, and it can lead to hepatotoxicity. Or we have someone who has been taking adriamycin for several years, and we know that adriamycin can actually lead to the toxic effect of cardiotoxicity. And then the difference between allergies and pseudoallergies. So for allergies, this is actually a subcategory. Well, it's a type of adverse effect. It's under the bizarre adverse effect. And if you have a true allergy, this is going to be a severe and life-threatening condition. So you're going to have, the shortness of breath, and you're going to have the wheezing, can lead to CV collapse, hypotension, hives. Pseudoallergy, so the word pseudo actually means false. So false allergies. And usually we see this in patients who think that they're having this severe and life threatening condition. They say that they're allergic to a medication, but what they're actually experiencing is that they're actually experiencing a side effect of a medication. So let's say your patient says that they're allergic to azithromycin, and you ask them, well, what happened when you took azithromycin? And they said, I had diarrhea the whole day. Well, you would explain to them in that case that what they actually experienced was a side effect, that they didn't have this severe life threatening condition. They're not actually allergic to it. They're just experiencing a side effect. And even though it's undesirable, they should continue taking that antibiotic in order to help them stop this infection or help them, with what's happening. Or for beta blockers, let's say they have a cough and they think they're allergic to it. Well, you should continue taking, even though you have this undesirable side effect, you should continue taking your beta blockers in order to keep your blood pressure in control, in order to reduce your risk of getting a stroke or getting an MI. Okay, well, I hope that helps, and thank you.